Good afternoon. Welcome to our 1 o'clock update. We're moving ahead an hour from usual due to the fact that the President is supposed to be addressing the nation after 2 o'clock in regards to the COVID-19 Omicron spread. So we are here a little earlier. Of course, joined by Kendra Schmidt from Deaf Access Services to provide our American Sign Language for those of might have a disability. And you'll be hearing from Dr. Burstein very soon. I just want to say one thing first. There's a lot of questions. Is Omicron here in our region? And we assume it is, though we do not have definitive proof yet. The Erie County Department of Health, as well as others, has been working with the UB Medical School Genome Institute, which does actually the sequencing of COVID-19 positive cases, or samples, I should say. And there's a 2-week lag or so, so they're just getting the cases that were sent to them at the end of November, early December. So we are, as of right now, have received no confirmation that Omicron is here, though we expect it to be here, considering what we're seeing elsewhere, including where it appears to be the prevalent line right now in New York City. These are the data as of December 19th. The Department of Health epidemiological staff is still in the process of confirming how many cases there were for the 20th. So this is the information that would have been released yesterday, with 451 new cases for the 19th. A positivity rate for the day of 9.4%, which is one of the larger positivity rates we've had on a day, but that can change on a daily basis. And this was a Sunday, the data for the 19th, so as often a lot of people who are going to get tested on a Sunday are those who are sick, and often the positivity rate for that date is generally on a Sunday a little higher. We're expecting the data for tomorrow or yesterday to be available very soon. Regional cases. Erie County is doing better than the rest of what would be considered our traditional Western New York region for a 7-day average, as well as the cases per 100,000. You can see the 7-day average for Erie County was 8.3%. The next lowest was Orleans at 10, and Genesee 10.1, and onward up to Cattaraugus at 12.0. The same thing with cases per 100,000 over a 7-day average. Erie County is the lowest for the Western New York region. So good job, Erie County residents, especially those wearing the mask. It makes a big difference. It keeps the rates down. We know that the numbers in some ways should be higher in Erie County than in any other county, due to the fact that we have many more people living in a tighter area, a much more dense population than some of these other counties. So thank you to all in Erie County. Other regions, as we know, in New York State are seeing dramatic rises in their cases. I was just on with county executives on a conference call for New York State, and one county executive, Steve Newhouse from Orange County, noted that he had just a few weeks ago 600 cases, and now they're up to 3,000. So we've had a big increase in the number of cases in a very short period of time. And as you may have heard, New York City or New York State keeps on setting records for the number of new daily cases that are being identified. We have at least a good story to tell, at least for now, which is the decline in the cases in Erie County. There were 3,472 cases that were determined for the week that ended on Saturday. This was a 20% decrease from the week that ended on December 11th, which was the second consecutive week of declining cases. The 7-day case rate per 100,000 as of that date, Saturday, was 364. It was down from 455 the prior week, and it was down from over 500 the week before. The positivity for that week ending was 8.1%, once again a decrease from the prior week. We're happy to see this. We're not certain it's necessarily going to last with Omicron, because Omicron appears to be much more transmissible than Delta and the prior Alpha original variant of COVID-19, 3 to 4 times as more transmissible. So we do expect the case numbers in Erie County to continue, hopefully to go down, but we do expect them over time, especially with the Christmas holiday coming up, to go up because Omicron is that much more transmissible. So these are great numbers for the last couple of weeks with the decline, but we're still afraid about what the future may bring. The positivity percentage declined in all age groups. The children under 18 still have the highest positivity rates. For those from basically birth to 17 years old, the positivity rate for the 1 week that ended this past Saturday was 8.7%. For those totally all over the age of 18, it was 7.9%. So there's still a decent amount of transmission, higher than the other age groups among children, and that is a concern. And as is often the case, the 20 to 29-year-old has the highest case total. These are often the ones that are not wearing the mask the most because they think they're invulnerable, but that is not the case, and as unfortunately was seen in the past week, an 18-year-old without any real complications died in Warren County near Albany from COVID-19. So just because you're young doesn't mean you can't catch it, and of course there are cases, I should say, infrequently as they are, but there are cases of very young people catching it and dying. Cases per zip code for week ending December 18th. It's urban, suburban, rural, continues to be everywhere, widespread transmission in all our zip codes in Erie County, but thankfully this number is declining. It wasn't that long ago. The total new cases per 100,000 persons in the past 7 days was over 1,000 in some of these zip code areas. We are seeing a decline, as we said. That's a good thing. We want to keep it that way, but just by seeing that when you look at the top 10 zip codes based on the percentage of the population per capita, Buffalo, Collins, Springville, Angola, Buffalo, Irving, Blaisdell, Buffalo, Lancaster, Buffalo. We actually have seen it creeping up in Buffalo, so we are a little concerned that there doesn't seem to be as much concern in the city as there should be. So please be careful regardless of where you live. Wear your masks. It'll help prevent against future transmission. We know that is the case. And one of the reasons we know it's the case is because what we're seeing with hospitalizations and, of course, those case rates declining. So for the hospital 2-week period from the 6th to the 19th, you do see there's been a nice little decrease. It's not every day decreasing. Some days go up a little bit, but we are seeing an average decrease in our hospitalizations in Erie County. And we are seeing that our hospitals are still near capacity for inpatients and ICU. One thing I want to note is the ICU numbers. The ICU numbers probably look better than they are because the ICU numbers at some of our hospitals, like Oshai Children's Hospital, as well as Roswell Park, are a little lower. But those are not acute care facilities that get most of our folks. For the 19th, the following hospitals had every ICU bed full in Erie County: Kenmore Mercy Hospital, Buffalo Mercy Hospital, so South Buffalo Mercy, Sisters of Charity Hospital. There was not a single ICU bed available in any of the Catholic hospitals in Erie County. And what we've seen in the last couple of days, which is a little concerning, but has been shown in the reports, Buffalo General Hospital, our largest hospital with the most ICU beds, has been full the last few days. 123 ICU beds, they've all been full the last few days. Millard Fillmore Suburban, I think, is at like 90% ICU capacity. So while we have seen a decline in the overall hospitalizations, and ECMC, thankfully, has had a decline in ICU beds, which is a rarity, but it's good. We are seeing a lot of very ill, sick people for various reasons, including COVID, in our Erie County hospitals, and that's why we need to continue to act appropriate to keep those numbers from getting and going higher. Now, patient vaccination status, as of December 19th, 67% of all COVID-19 hospitalized patients in Erie County hospitals were not vaccinated, not fully vaccinated. So roughly a third were. Those are usually much older individuals, generally over the age of 75. Those that are in the ICU, once again, 67%, or a third, or 2/3, were not fully vaccinated in the ICU. And once again, the vaccinated were 33%. They generally are very old, often have complications that make it such that they don't have strong immune systems. Those that are on a ventilator, airway assist, 74%. So roughly 3 out of every 4 individuals on a ventilator with COVID-19 in Erie County were unvaccinated, not fully vaccinated. And I think we've heard too many stories lately of individuals who are passing who are not vaccinated, who should be alive today but are not because they didn't get vaccinated. And those individuals are often the ones that were on ventilator as a last resort. Now, Erie County hospitalization data from March 2020 to the present, you see that nice little dip we've had in the last few days. We want to keep that going, but we are concerned with Omicron. If it is much more transmissible, 3 to 4 times more transmissible than the Delta variant, even though a lot of people have been vaccinated, we know there's still a lot more people who are going to catch it and potentially be hospitalized. Now, it's been a month since we implemented the mask mandate, and we believe the mask mandate has made a difference. The goal was to prevent the hospitals from being overrun. We saw what was happening. I'll go back a slide. And you can look back basically a month at where we were and how that hospitalization number was peaking, and then we implemented the mask mandate, and it's gone down. We are seeing, as we said, a drop in overall patients. We are concerned about the ICUs. But other nearby regions are not decreasing, and in fact, some are still growing. And I think this is important to note because Erie County has had a mask mandate now for 1 month. Others did not have a mask mandate, of course, until the governor instituted with the New York State Health Commissioner the mask mandate about, I'd say, 10 days ago or so, a week or so. So here's the Western New York hospitalization data from September 2021 to present. So just a 3-month chart. You can see how we had the rapid growth, and now we've had a decline. That's good. This is all hospitals in Western New York. This is not just Erie County, but these are all hospitals in Western New York. Finger Lakes region. The Finger Lakes region has actually had a steady decline, and they have not seen a decrease, though thankfully it appears they're plateauing a little bit, though they have had some very high cases in the last few days. Finger Lakes is generally considered the Rochester area, but it also, for the state purposes, includes Orleans, Genesee, and Wyoming County. Central New York, Syracuse. You see from September to 2021, they had a bump early, then they dropped, and now they've had a spike, and that spike continues to grow. Southern Tier, so this is an area basically to the east of Allegheny County, but Elmira, Broome County, which includes Binghamton, and they've seen growth. Little plateau lately. Let's hope that they are plateauing as well. But we are the only region really in upstate New York in this area that we consider our peer areas that's going down in hospitalizations. And we believe it's because of the mask mandate. It's been a full month. It's had an impact. I mean, I was at a lot of places this last weekend doing my Christmas shopping and so forth, and people were wearing masks. And it's a good thing because it's protecting the public. It's protecting them, and it's ensuring that as we go forward, we keep our hospitals from being overrun because that's the key. Vaccination update through December 20th. Some really good news. Those 65 and 74 in Erie County, 99% of them, according to New York State, have at least received 1 dose. The numbers you see on the screen do not include boosters, and it is key you get a booster, especially if you got vaccinated more than 6 months ago with the Pfizer and Moderna. As the doctor will note, and as you probably heard, the boosters really provide you extra protection, much better protection actually than what you had after the second dose. If you don't get the booster, though, your protection is waning. If you had the Johnson & Johnson shot, based on evidence that is being seen elsewhere, the Johnson & Johnson is not so good at protecting you from the Omicron. You should get another dose, but not the Johnson & Johnson. You should get a Moderna or Pfizer dose, preferably Moderna. And that's to protect you, because we know with Omicron becoming the dominant variant across the country that it is important that we have our population protected so we have the best winter possible and we have the safest Christmas season possible. I'm going to turn it over to Dr. Burstein now to talk a little bit more about what we're seeing with vaccinations, the impact it has. Excuse me, I got one more slide, or 2 more slides, and that's mortality data. As we announced yesterday, 34 additional Erie County residents were confirmed to have passed through December 16th. This was primarily December 10th through December 16th. Included in that group were 3 individuals under the age of 50. We do offer our deepest condolences to any individual who lost a family member or loved one, a friend due to COVID-19. I've run into a few people lately who have, and it's just terrible at this point where we're still losing individuals when we have the ability, hopefully, to protect them with vaccines. The vaccine effectiveness from July to December of this year, the average age of those who may have who perished from COVID-19 in Erie County that were fully vaccinated were 80. The average age of those who were not fully vaccinated who perished were 70. Among the most recent group, the 34 deaths from December 10th to 16th, the average age of those who perished who were fully vaccinated was 79, and for those who were not fully vaccinated was 67. Big difference. It's a big difference. So please get vaccinated. It really makes a difference in protecting you. I know for some people I'm probably, it's not going to matter, but hope you listen to your doctor. I hope you listen to a loved one. If you had a loved one who was lost, please remember them in the best way you possibly can by protecting yourself by getting vaccinated. And with that, I'll turn it over to Dr. B.
Thank you, and good afternoon. So as President Biden recently warned U.S. residents that this winter for the unvaccinated, this will be a winter of severe illness and death. And these are data from the Centers for Disease Control and Prevention looking at COVID-19 related death rates by vaccination status, where the unvaccinated are in the dark line with the steep curve, and the vaccinated, fully vaccinated, are in the blue line. So you can see that along the course of our COVID-19 pandemic, since the early spring, the people who have been fully vaccinated their rate of death have not really increased from COVID-19. It's been pretty much of a flat line. However, among people who are unvaccinated, we've seen a significant increase in the rate of COVID-19 related deaths for those individuals who are not fully vaccinated. So please, if you have not been vaccinated yet, please strongly consider getting vaccinated. You do not want to have a winter of severe illness and death. So, and what's going to be causing our severe illness and death for people who are unvaccinated is the Omicron. So we know that it is already in the United States, and actually just within a week's time, we've seen a significant increase in the proportion of COVID-19 cases that have been attributed to Omicron. It went from just 2 weeks ago from a little between 13 to 15% to this past week to 73% of all the COVID-19 cases are Omicron. And you can see on the map on the upper right-hand side, number 2 corresponds to region 2, which is primarily New York State and New Jersey. And we have about 92, 93% of all the reported COVID-19 cases that have been sequenced have been from Omicron. So this is a very, very rapidly spreading virus. I can't even remember any virus that I've seen spread so rapidly, even more contagious than measles. So we all have to be very careful and do everything we can for primary prevention to prevent getting infected, and then also to prevent getting very ill if we are infected. Because as we are talking about what's going on in Erie County, how we're responding and helping to keep people safe this winter during COVID-19. I think everybody knows that there are monoclonal antibodies out there as a treatment for people who are infected with COVID-19 before they become very ill. And I think a lot of people think, well, I don't need to get vaccinated. I can just get the monoclonal antibody infusion if I get infected, and I won't have to worry about getting into the hospital or dying. But really, that's not the case anymore. So we know that there are currently in Western New York, the hospitals have been able to offer 2 monoclonal antibody products, the Regeneron and the Eli Lilly product. The problem is that the indications is that they have significant loss of activity against the Omicron variant, so they won't work that well once we get Omicron in our community. Now we're pretty much Delta, so they work well. If you can get it. They are in very short supply here in Western New York and throughout the United States. So many people who should be eligible for a monoclonal antibody infusion just can't get them because there's not enough availability and there's not enough accessibility. So people can't really count on that. There is, fortunately, one monoclonal antibody product that has been FDA authorized for emergency use, the Sotrovimab, and we believe that it is active against all the variants of concern of COVID-19, including the Omicron. However, the federal government controls the supply and the distribution, and the New York State Health Department has relayed to all the local health departments that pretty much for the past 4 weeks, we have not received any shipment of this monoclonal antibody product, and we are out. So again, when Omicron hits our area, we're not sure if we're going to have this effective monoclonal antibody available to us. So if people's plan A is to get a monoclonal antibody infusion, if you are infected, you need a better plan B because that may not work. So we are working with schools to make sure that children and students and staff stay in school as much as possible. We are thankful to the New York State Health Department has just sent us a large supply of COVID-19 rapid antigen tests, and those are for schools to use for diagnostic testing. So a student or a staff person finds that they're in school and they're ill, they have symptoms, they'll be able to go to the nurse's station and get a test right there so they'll know if they can stay in school or if they have to go home because they have COVID-19. Remember, these rapid antigen tests are not as sensitive as the molecular diagnostic tests that we use, the ID Nows or the PCR tests. So we still, if people have symptoms and they have a negative rapid antigen test, we still strongly encourage people to get a confirmation PCR or an ID Now, just to make sure that you know what you're dealing with and you don't have a false negative result. So we have been, starting this week, distributing these rapid antigen tests to all the schools that are licensed to be able to perform these tests. And also we've been informed, fortunately, by the New York State Health Department. They are going to be providing us additional COVID-19 rapid antigen tests that will not only be able to use for diagnostic testing, but these tests that are going to be coming to us in the future will be able to use for tests to stay. So we'll share the information once we know more about when we can expect the distribution of these tests. So I know I sound like a broken record, and the county executive has the same message, and you're probably sick of hearing from us about really begging people to wear masks. I know people are tired, you're sick of hearing this, you're sick of listening to wearing a mask. However, this is a very powerful intervention that protects us against COVID-19 transmission. And we know since the Omicron is just breathing down our neck, it's in New York City, and I'm sure it's traveling out west. We know it's in the Pennsylvania, Ohio area, and I'm sure it's traveling east. So we're going to get it if we probably already have it now. We just haven't found it yet. So it is so important to have a layered approach. So not only vaccinating, which is very important, especially getting the 2 doses of the mRNA vaccines, either the Pfizer or Moderna, plus the booster dose is very, very important. Plus, we all have to mask. Plus, we should keep our social gatherings small. Plus, if anybody is sick, they should stay away. And plus, if people are going to be going to a gathering, they do the right thing and get a test to know your status before you join other people. But wearing a mask is one of the very important and simple approaches that we can have to prevent COVID-19 transmission as part of our layered approach. So speaking of masks, the Erie County is trying very hard to make sure that everybody has access to these masks to keep themselves healthy, especially during the holiday season. So far, Erie County has distributed more than 1 million masks, either through our sanitarians, our first responders, our vaccinators, or other partners in the community. Right now, we are working with houses of worship to make sure that they have enough masks so people can celebrate their holiday safely. So far, we have more than 170,000 masks that have been ordered by houses of worship, and we are still taking orders. So we have, if you plan to, to celebrate this Christmas or New Year's at, going to your church or, any place of worship, make sure you have a mask and, give your house of worship a ring and just remind them this is available for everybody. We are also going to, we're not stopping there. We're also going to be announcing in the near future some other distribution sites throughout the county. We want to make sure that every single person has at least one mask. So, as we said earlier, vaccinations are a key strategy to prevent COVID-19 transmission and moderate to severe illness and death. Remember, this is going to be a winter of severe illness and death, so people who are not vaccinated. So we are all over Erie County this week and next week and through January to offer COVID-19 vaccines. We have Moderna and Pfizer for all ages that they are FDA authorized starting at the age of 5. We have first, second, third doses, booster doses. So we can give you anything that you need of the Pfizer and Moderna. So Monday we're going to be in Amherst at the Adult Day Services. Tuesdays we're going to be in the city of Buffalo at Delavan Grider Community Center. Wednesdays we're going to be at Chestnut Ridge and Orchard Park. Thursday we'll be at Elmo Meadows Park, and this Friday we're going to be at the Orchard Park Fire Company. Our hours of operation of our clinics are between 11 a.m. and 7 p.m. We recommend appointments if you just want to buzz through and get your vaccine without having to wait very much by calling 716-858-2929. Or you can go to our website at erie.gov/vax, V-A-X, and look to see what appointments we have available in an area that is close to you and make an appointment for a time that's convenient. If for some reason it's you're not able to make an appointment, we welcome walk-ins at all our clinics. Of course, we take priority for the people who already have appointments. However, usually the last 2 hours between 5 and 7 p.m. are not very busy, and it's really easy for people to walk in and get a vaccine dose right away. So we also have some fixed locations for our vaccination. We are at SUNY ECC South Monday through Friday between 12 and 4, except on Wednesdays we extend our hours till 7 p.m. Also, we've been partnering with Buffalo Home Care, our great partners in testing and vaccination. They are offering vaccines on their 490 Delaware office and also at their 5847 Transit Road office in East Amherst. They're open weekdays between 9 a.m. and 8 p.m. So if you're driving home, want to end your day with a celebration of getting protected, stop off and get a vaccine. And then on the weekends, they're open between 9 and 5. Also, if none of those work for you, we have all the information of where Erie County offers vaccinations at our website at erie.gov/vax. If you choose to get a vaccine without leaving the comfort of your own home, we can do that. Just give us a call at 716-858-2929. We'll take in some information, and Buffalo Home Care will contact you and make an appointment that is convenient for you to come to your house and vaccinate you or any members of your family. Also, if you want to look at the larger options of vaccination availability in our community, you can go to the federal government's website, vaccines.gov, to look where other vaccines are available. Many pediatricians and other primary care offices are offering COVID-19 vaccine. I just want to say a big thank you to UBMD. They're getting up and running to offering COVID-19 vaccines at their specialty clinics. And also, we continue to work with our schools throughout Erie County, including the Buffalo Public Schools, to hold vaccine clinics at the schools for the students, staff, and their families. So it's still very important. A key strategy to prevent transmission is to know your status of COVID-19. At the Erie County Health Department, Monday through Friday, we are offering free COVID-19 tests. So even if you've been vaccinated, even if you have just like a little sniffle, something you think you get every year, it's really important to know your status, especially now in the holiday season when people are getting together in groups. And I'm sure you've all heard of these mass spreader events. I mean, you don't want to be the cause of one of these events among your friends or family. So we offer free diagnostic testing for all Erie County residents. We have the PCR, the molecular diagnostic test, which are the most sensitive SARS-CoV-2 tests available. Results are available in 1 to 3 business days. And then we're offering our point of care molecular diagnostic test, the ID Nows. Right now, they're available for symptomatic K through 12 students and staff. And however, we're going to open that up a little bit during the Christmas break that I'll tell you about just now. So just want to confirm that all the PCR tests that are positive, that are performed by our public health lab, we are sending to UB so they can do sequencing. So will not only know your status, you will help our community know what our status is in terms of variants of concern. So appointments are required. Give us a call at 716-858-2929. So as we have, the Erie County Health Department has actually expanded its repertoire of respiratory pathogen testing. So we have some new technology now, what we call a multiplex test. So in one specimen, it tests for SARS-CoV-2, which is the virus that causes COVID-19, influenza A and influenza B, and respiratory syncytial virus, or RSV, which is another virus that can cause severe respiratory symptoms. So Monday, we started offering anybody that tested at one of our Erie County Public Health Labs the opportunity to have a multiplex test where everybody is tested for all three pathogens. So you ask, well, what happens? What if I'm positive? So pretty much the same thing with the COVID-19. If you're positive for COVID-19, you'll get a call from our case investigators. They'll let you know that you've been infected, explain to you how to isolate, and explain how to notify your close contacts that they've been exposed and what they should do. If your test is positive for RSV or influenza, we will still call you, and we will strongly advise you to talk to either your doctor's office or an urgent care center to figure out how you should be treated with these viral infections. So we are not a treatment facility, we're a diagnostic facility. So we really encourage people, if they get a positive test, to talk to their healthcare provider or an urgent care center. Remember, there is a treatment for flu if it's found early, and it really shortens the course and lessens the severity of influenza infection. So we notify everybody with their test results between 1 to 3 business days. So you will know your results in just a day or two. So we are also, during the Christmas holiday, since the K through 12 students and staff will not be in school, so they will not need to urgently know their COVID-19 status if they have symptoms, we are going to open up our ID Now, which is our rapid molecular diagnostic testing technology, to all Erie County residents that are symptomatic and want to know their status. So through the Christmas holiday of school break through December 23rd, and then the week of December 27th to December 30th, any Erie County residents that has symptoms, they can call us at 716-858-2929 and get a really accurate test result available in 15 minutes. So just a clarification, these rapid tests do not identify influenza or RSV. They are just a single test for SARS-CoV-2. So I'm going to turn the rest of the presentation over to our county executive.
Thank you, Dr. Burstein. As a reminder, because of the holiday, we will not be on this Friday, December 24th, Christmas Eve, or the following Friday, which is New Year's Eve. We will not be doing testing and having vaccine clinics on those days. So if you were planning on getting a test, get it ASAP. Don't wait until the 24th for Christmas. Call us now at 858-2929 to schedule testing, as well as to schedule a vaccine. We will be closed, of course, for Christmas Eve and Christmas Day, as well as the 31st and the 1st for the New Year holiday. I did want to talk about rapid home COVID-19 testing. As some of you know, 2 weeks ago, I was invited to join a number of county leaders at the White House to discuss issues with COVID-19, as well as issues regarding the infrastructure, and COVID-19 made up a big portion of the discussion. We actually had the White House Director of Testing there, and one of the things that was discussed was the rapid at-home test as it pertained to Omicron. And there was a concern, and the CDC and the FDA were running analysis to determine whether every rapid home test that is technically available can identify the Omicron variant. And as of that time, it was not certain. Since then, the CDC and the FDA have identified the rapid at-home tests that can actually identify the Omicron variant. The Omicron variant is a lot different in some ways than the prior variants associated with COVID-19. As a result, I spoke to Governor Hochul last week. Actually, I spoke to her again on Sunday. But last week she informed me that based on the information, once they had confirmation of what tests would actually be able to identify the Omicron variant, that she would be sending out hundreds of thousands and millions of at-home rapid tests to be used by the counties and the municipalities to provide to their constituents, which she announced yesterday that 5 million in total will be distributed across New York State. Half of them primarily for the school setting, but the rest to go to local municipalities, government counties that is, to distribute locally as needed. We are expecting a significant supply. We do not know how many we are going to get, but we are expecting by the end of this week and a half, so to speak, the end of the month, we are going to get a significant supply. These will be able to identify positive Omicron variant cases. Not all over-the-county rapid tests are able to identify the Omicron variant. The FDA has on its website those that they have identified that are good for identifying Omicron and those that are not so good. If you get the Abbott Binax now, it's a good one. But if you don't get one, if you ordered one on the internet, never heard of it before, you might want to check with the FDA site to determine if it's possible to identify the Omicron variant. There is also a concern, and this is something that is a legitimate concern, that there are false negatives associated with some of these at-home tests, especially if the test is taken at the same or like within a day or two of the person having been exposed, where they don't have a significant viral load yet. So there are questions as to whether or not every at-home test is going to identify Omicron. The ones we're getting from New York State will. And then there's also the concern that if you get tested, if you were exposed on a Saturday, you got an at-home test, you took it on a Sunday, it could come back negative even though you may actually have the COVID-19 virus in your system. Then you go to the family on Monday or Tuesday, expose them in your asymptomatic phase, which you can, of course, shed virus and a lot of it in an asymptomatic phase, thinking you're safe when, in fact, you actually are spreading COVID-19. So there is a lot of concern with the at-home tests. There's a lot of pressure to just buy as many as you can get and give them. Well, we are identifying additional testing kits that can be distributed at community centers, libraries, with more to come. We waited. We did not want to purchase and put a huge purchase order in for at-home test kits that might not be able to identify the Omicron variant. We now, as of basically the last 3 days or so, actually know which kits can actually identify the Omicron variant. And they won't tell us it's Omicron. They just will know that it's a COVID-19 positive case. Only a PCR test that is then genetically sequenced can in all likelihood identify whether you have Omicron or not. It has to be genetically sequenced to determine if you have Omicron. But at least these most recent tests that have been identified by the FDA can say whether it is a positive COVID-19 case, even with the Omicron variant. So the County Department of Health, working with our purchasing office and others, are looking to identify additional testing kits that we will be purchasing to distribute at community centers and libraries, with more to come. But we did not want to go ahead and purchase hundreds and thousands of testing kits, first off, knowing that the state was going to provide us a substantial supply for the short term, but also, and more importantly, we didn't want to buy testing kits that would be useless against Omicron. And now that we have the information, we can go out there and purchase them. So that is part of our plan. To all that are out there, we certainly wish those that are celebrating a Merry Christmas, that you have a very safe and happy and healthy Christmas. The best way to do that is to know your status, to get tested. As we said, Erie County, you can call us at 858-2929. We will schedule testing with, of course, the Abbott ID Now rapid test, so you'll have the results in 15 minutes starting on the 23rd. You can also get PCR tests, and it's basically taking 1 day to get the results back. Those PCR tests then are sent to the UB Genome Institute so that they can do the DNA sequencing and determine if you actually have Omicron or Delta. But to all, we want you to have a safe and healthy and happy Christmas, and be safe out there, because it is, of course, with the Omicron variant spreading very rapidly across the United States. Even if we do not have a definitive case here locally, we assume it's here. So with that, I'll turn over to the media or open it up to media for questions. And we will start with WBFO Michael Mroziak.
Good afternoon, Mark. Actually, my colleague Emily Watkins is joining this call, and she has questions, so I will defer to her.
Hi there, thank you. I have two quick questions about rapid testing. First, I'm wondering, is the only type of rapid testing considered for students in the test to stay protocol? Is it only the point of care rapid testing, or can families do the home rapid test?
No, they cannot do home rapid tests. And we're expecting New York State, when it issues its test to stay guidance, also to say the same. That was just brought up on a recent call. It is the point of care. The rapid test, as we noted, because they can give you false negatives, they are not acceptable for the test to stay program.
And likewise, I know sometimes businesses require a test within 72 hours in order to enter the business if you're not vaccinated, like for concerts and that sort of thing. Could home tests be considered for something like that? And could you explain the difference between point of care and home testing, and why that point of care should be prioritized?
Well, I'll talk about the businesses and then turn it over to Dr. Burstein about the difference between home and point of care. Businesses do have the option, if they so choose, for a vaccine mandate. There is no vaccine mandate or testing out. It is a vaccine mandate or a mask requirement. So they do not have the option to do testing out under New York State. It is a mask mandate or it is a vaccine mandate, which means you actually have to be vaccinated, show your card, fully vaccinated, as well, or your Excelsior pass. That is the rule as passed by Governor Hochul, as well as what we had in for Erie County with regards to the mask mandate. And I'll turn it over to Dr. Burstein to talk about the point of care versus home tests.
Thank you. So, Emily, that's a great question. I think it can be confusing. There are all these different types of rapid tests out there. It can be very confusing. So, whether a rapid test and rapid antigen test can be used as a point of care test, so that is a test that is CLIA waived, as some type of CLIA licensed facility has to be able to do this test. And so it's the point of care tests are actually done by a facility that and by people that are licensed or trained to be able to do this test, whether it's a wave test and they do QI on it, and they report their data to the New York State ECLAIR system. Or it, or it could also be a laboratory test, or it could be done at a pharmacy. That is what the test manufacturers have applied and received authorization for the FDA. For the home test or the over-the-counter test, many times they can be the same test. However, those test manufacturers have applied to the FDA to be able to offer these tests for use at home. So they come with instructions. However, there can be more opportunity for user error because it's not in a controlled setting. There's not a good, robust QI system in place. However, we all know the huge convenience of a home test, being able to do a test, whenever you want, wherever you want, in the privacy of your own home. So again, the short of it is, many times these can be the same test. However, the over-the-counter test or the home test have FDA authorization to be used at home without somebody who has a CLIA waiver or a CLIA license, whereas the point-of-care tests, those are authorized by the FDA to be used in a facility that either they have a CLIA waiver or a CLIA license, and they have a QI program in place. Did I answer your question?
Yep, thank you.
TMI? Thanks.
Okay, next question to Brayton Wilson of WBEN.
Mark, can you hear me okay?
Yes.
Okay, great, thank you. Just wanted to ask you, what do you make of the governor's comments yesterday regarding the new stadium for the Bills? And I know that you said personally that your timeline would rather be for the end of the year to get a deal done, but can you add anything in terms of a timeline where you guys are comfortable with getting a deal done for a new stadium?
Well, without going into the details associated with the negotiations, as we said yesterday, these are very complicated negotiations, and the goal is to get the best deal that is fair for all, keeps the team in our community, and that's about all I'm going to say. Are trying to get a deal done, and unlike signing a lease for a house or a business, this is a very complicated transaction, and it has three parties, and we need to have all three parties involved. So I'm not going to get into all the details, but right now our goal is to get a deal done. We've had conversations between all the parties multiple times in the last few weeks, and we will continue to have conversations until we get a deal done, and then we'll announce it then.
And if I could just follow up real quick with a question regarding Test to Stay. I know you've been working with Grand Island with their pilot program, and with the CDC's endorsement of the Test to Stay program, what's going to be the county's role in making sure that Test to Stay is implemented in the schools? And just your thoughts on the success rate of the Test to Stay program with Grand Island itself.
Well, we do plan on expanding it. The Test to Stay pilot with Grand Island is through the remainder of this quarter, which ends, of course, in the next day or two. We plan on expanding it in January to other school districts that are interested. There are rules that we have in place right now, but we are also waiting to hear from New York State as to whether they're going to be changing some of these rules, and that we'll have to follow a different protocol, so to speak. But if a school district is interested, they should contact the Erie County Department of Health COVID-19 school team, which I'm sure they know very well by now, and let us know their interest in the Test to Stay program, and then we can tell them what the requirements are for the school district to do and what the county's role will be. We do plan on expanding it starting in January, but we're also waiting for further guidance from New York State, because the guidance that comes from New York State may actually change how we're running the program with the pilot in Grand Island. Next question to Sandy Tan from the Buffalo News.
Hi, Mark. Thank you. The governor had mentioned providing more money to municipalities to help enforce the mask mandates across the state. I was just wondering if the Erie County Health Department had plans for using that money to help with its enforcement efforts. I was also curious to know about any plans the county might have to purchase more rapid antigen tests. Most major cities and counties across the country have already purchased these and have begun distributing these. So I'm just wondering if you are planning to purchase more of these and have these available to distribute after the holidays.
Well, that's what we announced, is we're planning on purchasing more and acquiring more. Right now is there's just difficulty in getting them, because I believe the president's going to announce very soon that he's purchasing through the federal government hundreds of millions of rapid tests. So there's a little issue with regards to procuring them at this point. And as I noted earlier, not every rapid test, it appears, could actually identify the Omicron variant as a positive. So now that we know what they are, we are moving forward with that. The first question was in regards to, if you remind me.
Regard to the money that the governor's making
yes.
available to enforce the mask mandate.
Yeah, the governor is, there's a $65 million that the governor announced yesterday. She told me about this over the weekend, that she would be offering this to counties that are having trouble enforcing the mask mandate due to lack of staffing, not having a hotline, so to speak, where people could call in with complaints. Erie County has been continually have our sanitarians going out. We actually are finding very good compliance. That's a good thing. Of course, with many of this stuff associated with the state government, you have to actually do the work, spend the money, so to speak, and seek reimbursement later. So what we're trying to see is if the work that we've done will be eligible for reimbursement, or if it was effective as of the state. I believe it's also a carrot that the governor is putting out there. If you are a county, and we know there's a number of counties that said they're not going to enforce it, they're not getting one red cent. I know that to be the case. If they enforce the mask mandate, then they can actually seek reimbursement for the costs associated with enforcement. So we would seek reimbursement for the costs associated with enforcement. The question is whether or not we can go and seek reimbursement for past actions or if it's only future actions. And then it's also a question as to how long it will be there for. Is this a 65 million? Sounds like a lot, but you also have to remember that's for the entire state and includes New York City as well, which of course has its own mask mandate and vaccine mandate. So a good chunk of that 65 million is going to disappear real quickly as it's allocated for New York City and Long Island. But we'll seek what we can get. And I would recommend to the other counties that have said they're not going to enforce the mask mandate, the numbers are quite clear. The numbers are worse in most of those counties, and they should not be because they have less population and a less density. It's in their best interest to enforce the mask mandate to protect their own citizens. Channel 4, George Rickert.
Hi, Mark. I know you've talked in the past about sewage testing and how wastewater testing gives you sort of an early heads up on what's to come. Will sewage testing be able to tell you when the Omicron virus is here and whether it can or cannot give you an early jump on that? What is sewage testing or wastewater testing telling you about what's to come in 5 or 7 days? Is the trend continuing to go down in the sewage testing?
Well, it cannot tell us in regards to when it identifies COVID-19, whether it's Omicron. That requires genetic sequencing to do that. It can tell us whether or not there's a spike. It seems to be an increase in the number of COVID-19 samples it's picking up from the wastewater treatment. I know Dr. Burstein has some information on that, and I'll turn it over to her. But in regards to the first part of your question, the answer is no, it can't identify Omicron. It can only identify COVID. But it does give us an early warning if we see spikes in the sewage treatment numbers. It generally tells us that there's higher preponderance of COVID than there was in the days prior, and then we usually see it in the positive test results that come in afterwards.
So thanks for the question about wastewater. So we've been actively partnering with UB they've been working with us to collect specimens of wastewater and then analyze them, look for the RNA of SARS-CoV-2. And so far the results have pretty much been parallel to what we've seen in terms of the number of cases in the community and the case rates. So, and again, they've been about a week ahead of us and followed what we see in terms of test results very nicely. A couple weeks ago, UB started sending their SARS-CoV-2 identified in the wastewater to Wadsworth Public Health Lab to do genetic sequencing to look for Omicron. So far, they have not been informed that they've seen any positive results for Omicron from our wastewater. However, in Albany, the Wadsworth Public Health Laboratory is receiving our specimens and looking for it, but has not reported to us any that's been found yet. And we're going to be following those wastewater data very closely throughout the holiday season to try to anticipate any increases from, again, post-holiday surge or from the Omicron variant causing increased numbers.
Febin Casahan from Channel 7.
Hi, yes. So I just have one question. So Erie County is seemingly following New York City's lead in protocols. And since the city has implemented the whole vaccine mandates and eating indoors and things like that, and I understand that is level 2 for Erie County at the moment, do you think that that's going to be implemented sometime this week or sooner than that?
We review that on a weekly basis, as we announced last week. It all depends on where we stand with cases and hospitalizations. Right now, we have no indication that we'd be going into phase 2 because cases have been declining as well as hospitalizations. If both took a rapid increase in the opposite direction upward, then we would consider it. But right now, there's nothing that's changed since last week. We continue to see a decline in new cases. We continue to see a decline in hospitalizations, not a big decline, but a decline. And if those trends continue, we should be staying in phase 1. There should be no reason to go into phase 2. Emily Gersh, Fox 29.
Hi, Mark. Can you hear me okay?
Not really. Could you speak a little louder, or?
Okay, how is it now?
That's a little better. Better, yes.
Thanks for taking my question. So the DPS superintendent sent out a letter to parents and staff yesterday asking students and staff to bring home their laptops in the event that school resumes remotely after the Christmas break. At this time, does the county have any plans or any guidance on the rest of the school districts, or are you deferring to the state on that?
Well, I mean, the superintendent in the Buffalo School District made a recommendation based on probably just preparation for the worst-case scenario. We don't see that as being a case here because our numbers are going down and the hospitalizations are going down. We do know that Omicron is in New York State. It's probably here. It's going to, in all likelihood, result in some increased cases. But right now, we don't see any reason to have schools shut down. That's why we're going to be expanding our testing to state program, so that if there is a positive case, we can actually ensure that the child is tested or the staff member is tested rather than automatically being quarantined. That is the best way to keep students in school. So we will be expanding that. If the city of Buffalo wants to participate in the test to state program, they certainly have the option to do it. There are certain requirements that are made of all the school districts when they decide they want to be part of the test to state program. And if the school district, any school district in Erie County is interested in learning more, as I said earlier, they should contact the Erie County Department of Health school team with regards to what is necessary to participate in the test to state program starting in January. Is anybody on from Channel 2?
Yeah, Steve Brown. A couple of questions dovetailing off of the previous question just a little bit, but they're both school-related. One, is the county reporting positive tests to school districts? I think that was a practice that was done earlier. It's unclear if that's continuing. And also, based on what you've been told about the amount of testing supplies that will be made available to the county, how confident are you that a broader test-to-stay initiative for school districts like BPS will be able to stay in person even if cases rise?
Well, first off, Steve, I was disappointed to hear you're leaving the market, so good luck in Indianapolis. Regarding the second part, a lot of it's going to depend on what the president's going to be announcing very soon with regards to the rapid tests that are going to be sent. I know part of it is associated with school testing. The governor has announced yesterday with regards to the first $5 million is dedicating half of it to schools so that there is sufficient supply for tests to stay. And she did note that this is just the beginning. They're expecting to purchase more in these large bulk purchases. So we expect to hear more about that in the next week. I'll turn it over to Dr. Burstein to talk a little bit more about notification. I'm not certain about the answer to that question.
Thanks. So just in terms of the Erie County Health Department working with the schools, it's the school's responsibility to notify our Erie County Health Department school EPI team if they do have a case associated with a school, either a student or a staff member. And then it's a two-way street. During our case investigation, if we identify someone who is a COVID-19 case that is a student or staff person, we will notify the school and ask them to help us collect information about who their close contacts were in their classrooms or extracurricular, so we can complete our case investigations in the school, because that is a high-risk situation. We want to make sure that everybody is notified of their exposure, and people who are not fully vaccinated that are close contacts go into quarantine until we were able to roll out test to stay in all the school districts. So it's really a two-way street working together. The schools notify us, and then through our case investigation, we also notify the schools to get additional information about close contacts. Thanks.
Got it. Thank you.
Thank you. Spectrum News, anyone on from Spectrum? If not, is there any other media outlet that it was not called upon? Not just a reporter, but an outlet? B News? If not, then we basically reached an hour, and I know the president's supposed to announce and make a major statement and speech to the nation very soon, so we want to get off and wish everyone in the meantime a very happy and Merry Christmas to those who celebrate. We will, of course, be working except on the 24th and the 25th, but we'll be here doing our work for Erie County to protect them, protect the public. We ask everyone to do the same, wear a mask when you're out in public. The numbers show that masking works, and hopefully we'll all get through this and have the best, most joyous Christmas that we can possibly have. And then we'll see you next week. Take care, be safe and well, and Merry Christmas to